There are concerns about public health care as some nurses took part in protest action today. Around 200 healthcare workers picketed outside the Chris Hani Baragwanath Hospital in Soweto. And of course, that's the largest hospital on this continent. Public servants across South Africa took part in a national day of action after rejecting government's wage offer last week again. The nurses were waiting for transport to take them to a march at the union buildings. And while patients could still access the hospital, the road leading to Chris Hani Baragwanath was blockaded with rocks and burning tyres. There were also reports of disruptions at other hospitals, particularly in the Eastern Cape. Well, the Rural Health Advocacy Project says it is concerned about the impacts of the workers' strike on essential health care. Let's discuss now. We're joined by the spokesperson for the Department of Health, Foster Mohale. Mr. Mohale, thank you for being with us. Give us a sense of the impact of the National Day of Action on healthcare, on hospitals today.
Good afternoon, Francis, and good afternoon to your viewers at home, and thanks for this opportunity. Yes, as we indicated earlier in the morning that we had a contingency plan across the country in all the facilities to ensure that this strike action does not negatively impact the provision of health services. Unfortunately, few pockets of incidents were experienced, especially in the major hospitals like your Chris Hani Baragwanath Hospital, which was the hardest hit facility across the country, where non-striking healthcare workers were prevented from entering the facility in order to assist to save lives. But unfortunately, that also affected our innocent patients who were caught in between. But generally, the strike did not have a major dent as far as the provision of health facility across the country is concerned.
So our reporter didn't see that. We were on the ground, but you are saying some nurses did prevent other nurses from entering and doing their work.
Yeah, we received the reports from across the country from our counterparts in the provinces, in all the districts, that there were some pockets of incidences like your Chris Hani Baragwanath, the hospital such as Ruking and other few hospitals across like in the Eastern Cape as indicated, and also Free State. Those are the provinces where we experience the challenges as far as provision of healthcare services concerned.
So a spokesperson for the Eastern Cape said in one of the hospitals, the theatres were only dealing with emergency cases and only 2 nurses arrived to work in the maternity unit. So what happens in that case? Because let's confirm that nurses are essential service workers, right? And they may not strike.
Yes, exactly.
So what happens?
Yeah, no, definitely. Yeah, no, definitely, because as I said that we had a contingency plan to show that in the cases like this, we're able to have other healthcare workers who can assist. For example, option 1 was that the doctors had to discharge the stable patients so that they can be able to go home. So secondly, the operational managers who are also qualified health professionals had to intervene in the cases where the nurses could not come to assist the patients who needed this much needed services in our facilities. So what you are saying about the Eastern Cape is exactly what was experienced in provinces like your Free State, where critical units like your ICU, the trauma, the emergency unit were also affected, but because of our contingency plan in places, we managed to avert the impact of or mitigate the impact of this. But also in terms of the violence that was experienced in hospitals like your Chris Hani Baragwanath, we worked closely with the law enforcement agencies who came to rescue the situation to ensure that the situation is under control. We are able to continue with the provision of these health services.
But my question again, because nurses are not allowed to strike, and let's be clear, most of them were at their stations today, but those who did take part in strike action or prevented others from working, what action will you take as a department?
Okay, yeah, no, let me respond to your question directly. Number 1, you remember that in public service, we've got the rule called no work, no pay, which is going to be applicable to all those who do not pitch up at work today, so that they have to, as part of the consequences management. But those who have intentionally disrupted the services, the police had to deal with them. Unfortunately, we cannot do anything beyond implementing the no work, no pay. But also we kept on reminding our healthcare workers that they are essential services. They've sign an oath, they sign the pledges that saving the lives of our people will remain a priority. So all those who could not pitch up at work, they are going to face that penalty, which is the no work, no pay, which is not only applicable to healthcare services, but all those who have participated in the strike across all the public service sector unions.
But with all due respect, anybody who doesn't pitch up faces the no work, no pay rule. So you're saying there's nothing beyond that for essential service workers who have signed that pledge that you're talking about. They are not even in the firing line.
No, look, firing line is the last option that you can imply. We cannot immediately rush to expelling any healthcare worker, but we're going to start with what we call this the no work, no pay. If remember, this was only today, so unless if the situation the strike will continue beyond today, then we'll be able to implement other options that we have at our disposal. So firing is the last option that we have in our arsenal.
The Rural Health Advocacy Project says it doesn't object to workers taking part. The concern is that workers have embarked on a day of action without a minimum service level agreement between the unions and the National Department of Health or the provincial health departments. Therefore, essential health services are not guaranteed. Can you explain this? Should there be a minimum service level agreement in place? This advocacy group is saying without that, then patients are at risk.
Look, I think, remember, this is very simple according to the constitution of the country, which simply says everybody has got the right to strike. But then the Labour Relations Act, I think section 213, which says the essential workers, which include the healthcare workers, they've got limited rights as far as striking is concerned. So in terms of the agreement between the union and the employer, but remember also the unions, whether you have got an agreement or not, the unions, if they feel aggrieved about certain decisions or the government not meeting their demands, they can still decide to go on strike with or without the agreement. But what we want to say to all our healthcare workers to say, we are going to work closely with other departments, but we believe that the government, working together with the leaders of the union, they will continue with the bargaining processes in order to find a long-lasting solution in order to ensure that the provision of healthcare services and other government services, they are not negatively impacted.
All right. Maybe we'll chat again. This is about protecting patients if the strike activity ramps up. We just saw one day of action today, but there are warnings that it could get much more intensive. That was Health Department Spokesperson Mohale.